Good morning, Vanessa speaking.
Good morning. I'm calling for Erica Rubinstein.
Sure, may I ask who's calling?
This is Rosalind Smith.
Okay, sure. Hold on a minute, Rosalind. Let me transfer. Hi, is this Rosalind?
Yes, it is. Hi, how are you?
Hi, this is Erica. Would you rather me call you Miss Smith?
No, that's okay. You could call me Rosalind if I'm calling you Erica. That works.
Okay, of course. Yeah, hi, Rosalind. How are you? And thank you so much for the communication. You've been so responsive. I really appreciate it.
Sure thing.
Typically, so my reaching out to you in the letter that we sent, myself and Dr. Stone, really, it's because we want to learn and we acknowledge that you have this experience with Dr. Francis. And we need to do better, right? I mean, we need to do better by our patients. And we want to, when I say partner, there's several ways that we do that with patients. We meet, we talk, whether it's virtually or whatever, we're comfortable with. We might have you share a story with a group of staff that can benefit from it. We might have you attend any number of groups with other patients or other families or other staff to partner with them. There's a myriad of ways that we would do that. That's separate and apart from you wanting to pursue something, let's say in the legal realm, which is also your right to do, right? But it, and I know that your aunt joined the initial call in January with Dr. Stern and Dr. Kanos and others. And again, you are welcome to have your supports there. And I do appreciate you telling me about, Mr. Rodriguez wanting to join the Zoom today. But it's not because he is family counsel and he's, maybe a colleague, maybe a friend, but also counsel. I have to say that that's not the tenor of this meeting. And so we would have to not have this meeting if there's an attorney present because it's not the purpose of the meeting, right? So you agreeing to meet with me to talk about partnering is sort of a coming to the table and saying, and maybe we're not there, right? And I can respect that. It's a coming to the table and saying, I have this experience with Dr. Francis. It was a difficult experience. We, as an organization, acknowledging that you had that experience and wanting to learn and wanting to make it known and wanting to share, right? But once, and again, it's absolutely your right to seek counsel, to go that route. I'm not telling you, what you can and can't do, but not for this type of a conversation, right? So that's just not the tone of today's, the intention of today's conversation.
I
right?
hear you. No, I hear you. And I am so appreciative that Mount Sinai wants to partner and that there is an interest in improving care for all patients. Like I think that, I've said a lot in what I've written thus far, and I think there's a unique opportunity to salvage value from something that otherwise, would be very negative. But here's where I'm at with this. I get your point about the tenor of the meeting, but my experience with Dr. Francis is that I felt very taken advantage of, and that is not something I want to relive again in any interaction that I have with the institution. I get it. Today is not about discussing, any legalities, but I do want to have my support system there, as an active listener to ensure that I'm not being taken advantage of. And if that is not, suitable, at this point, for us engaging together, to me, I look at it as just an added part of my story. And my goal, really, I would love to tell it with Mount Sinai, as opposed to about Mount Sinai, but I can't be in a position to be taken advantage of again.
So I guess I'm just trying to understand. So we are not trying to take advantage. I mean, you don't have to believe me. You don't have to take me at my word because you don't know me.
Mm-hmm.
But I am telling you, as a leader of this organization, that is just not our agenda. Not even close. And again, it to me, yes, having a family member join us, having a friend, a support, whomever, and by the way, I'd love to do these in person, right? I prefer in person to Zoom because you get to connect a little bit more and get to really get a sense of the people that are involved, right? And I don't feel, though, that if you're feeling as though we as an organization, right, me as a person that you're just meeting for the first time or we would be meeting on Zoom, is looking to take advantage of you, right, then I think we're not ready yet for this conversation. We're ready to partner with you. We are also, I also, by the way, wanted to give you information about physicians. You had asked if there were physicians that knew about your experience that could see you.
Okay.
And there certainly are, and I do want to share that with you. And that's obviously you can. What I would do, and I could still send you this email. Actually, I have links for their web links. So you could see them, you could read about them, and decide if you're comfortable with that. One of them you've already met because he was a part of the meeting in January, Dr. Kino.
Okay.
And the other one is a doctor. Her name is Zoe Rodriguez. And I wanted to send you, and I will send you their profiles so that you can see them and you can decide for yourself. But that's another piece of this is that we absolutely want to still have you receive care with us. So that would be something that we would send you.
Okay.
But again, it's not advisable for me to enter into a conversation with you and an attorney, right? It's and I don't want you to chalk that up to like another thing that they did. If you want to have a conversation with your attorney present, then we would have to just plan for that because that's a very different conversation.
Gotcha.
I want to have a conversation with you and maybe your family member, not somebody that's in a capacity to be an attorney taking legal action towards the organization, but in a way for your support to say, here's how we partner with patients, right, Rosalind? And if you want to partner with us in any number of these ways, I would like to move forward and do that.
Okay.
If you feel that I'm trying to take advantage of you and the ways that Erica is suggesting that we partner seem not helpful and not productive to what your needs are, then you absolutely would say no thank you and we'll move on. Right?
Gotcha. Well, this is what I can do. Let me see, because my aunt is a physician, she sees patients all day. So let me see if has any gaps, and I will get back to you to see if she can meet today.
Sure.
Yeah, so that's what I'll do. I'll just circle back with her and see if she can make it, and then I'll let you know what she says. But I do appreciate you kind of clarifying for me, about today. And one thing I was thinking about this morning, I still do need care.
Yep.
Yeah, I do.
And it would be our privilege to still connect you to care. So like I said, those two physicians, you know what, I have to find the site. I'm going to send it to you because I was going to do it while we were on the Zoom.
Mm-hmm.
But so what, right? I could send it to you now. I'll just send it to you. Those are physicians that absolutely know what happened, want to, definitely understand and empathize that you went through something, and they want to move forward, and they would love to be able to care for you.
Okay. And if my aunt can't make it, I'll send you a note whether or not we can postpone. But
Yeah.
I will ask.
Yeah. And if you want support there, I should have said that at the beginning. And I don't know why I didn't. I always offer that people have somebody with them when we're talking. Sometimes people don't want to, but I always say, bring somebody. Well, why not? If we were doing it in person, I would say the same thing. It's just that one issue that we want to just make clear that this is not that kind of a conversation.
Got it. Okay. Well, I will follow up with my aunt, then I'll send you a note. Good thing that we have a couple hours between now and the time we have scheduled. So
yeah.
I will get back
and I'll
to you.
make time if today doesn't work, and because your aunt's a physician and she's clinical today. If today doesn't work, we'll prioritize some time that works for you. I'm here. I'm not going anywhere.
Okay. All right. Well, thank you so much.
You're very welcome, and I'm going to send you that stuff momentarily.
Okay.
Okay, Rosin, we'll talk soon.
All right. Take care.
Okay, bye-bye.
Bye.